South Africa's largest food redistribution non-profit organization, Food Forward SA Foundation, has warned that urgent action is needed to address the deepening hunger crisis in the country, with millions of households skipping meals due to unemployment, the rising food costs and inequality. Now, a recent study by the organization, which was conducted by the University of Cape Town, found that 7 out of 10 households in the country experience food insecurity, and the study had focused on more than 700 individuals who already receive donated food aid. It further revealed that the number of people who are severely food insecure in the country rose from more than 5 million in 2019 to a whopping 8 million in 2023. Let's now welcome Rural Health Advocacy Project Executive Director, Mr. Russell Rensburg. Russell, welcome to SA Today. It's always a pleasure, sir. So let's first talk about these shocking statistics. I mean, 7 out of 10 households in the country are currently experiencing food insecurity. What has exacerbated these figures beside, of course, the ailing economy and high unemployment figures? Good afternoon.
Like I say, that's the 6 billion rand question. I think what's really difficult is we can't really speak about what has been exaggerating food insecurity in South Africa as, I think it's common cause that poverty and inequality is one of the binding constraints. But I think what we can do as the Rural Health Advocacy Project is talking about the health impact of a lack of good nutrition. And I think that's why it's central that, the authors of our Constitution inserted that in Section 27, that everybody has the right to access sufficient food, right? And in addition to that, we also include social assistance. And I think in part, it's important that we go back to those first principles now that we have a coalition government, where there may be differences of opinion in terms of what is social assistance, what's the empowerment, for us to get to first principles. And for that, we need to looking at what does access to good food mean. In the first 1,000 days of a child's life, access to good nutrition actually contributes to good brain development. And the converse is true. If you don't have access to good food, it impacts negatively on brain development. And that is why the president raised these as one of the issues to eliminate stunting in South Africa as an apex priority. So we need to figure out around that. The second thing is South Africa has a large infectious disease problem. Tuberculosis is the leading cause of death in South Africa, with over 56,000 people dying each year. One of the symptoms of TB disease, which over 200,000 people get each year, is rapid weight loss. It's common cause then that in order, as part of the recovery, when they go on to the medication, they need to also restore their body mass. True. So they need access to good nutrition. So I think the point here is that we need to try and figure out what are the kind of measures that our government at a national level should come together with to advance access to good nutrition, particularly for children. And we have to balance that out with the investments we make in social assistance, which are significant. But the two don't always correlate.
Thank you for raising those issues there, Russell. But I mean, let's talk about another aspect, right? You spoke about health taxes, right? Food taxes are another serious challenge when talking about this topic, right? Because at the center of it, the income poverty at household level has to be the center of any strategy in order to address food insecurity. And if the taxes keep rising, Russell, households will simply not be able to afford a simple food basket required for a month. I mean, even middle class are affected. Employed people are struggling and opting for cheaper, sometimes illicit and possibly risky products. So how do we then address these issues effectively?
Okay, I think we have to look at the entire food ecosystem and environment. And the thing with health taxes, we don't put taxes on food. I think the things that that we're focusing on in our health taxes campaign is harmful products. We know in the run-up to December, we spend almost R1 billion a day on alcohol. On average, we spend about 400 million on alcohol each day. And we know what the negative consequences of alcohol are. They're direct. They lead to trauma and violence. They contribute to gender-based violence in particular. We know also, for instance, that the leading cause of death amongst young men across all districts in South Africa between 15 and 25 is interpersonal violence, often driven by alcohol. So targeted health taxes on alcohol and tobacco and sugar-sweetened beverages have a triple benefit. In the first instance, they reduce incidence in the consumption of harmful products. By doing that, they reduce illness and future costs. And in the short term, they generate the revenue that we can invest in strengthening some of the more positive things that we need to do. For example, taxes on sugar-sweetened beverages and maybe even fast food can contribute to expanding the investments we make in the very successful school feeding program. And now with the extension to early childhood development, strengthening their program also means that we can contribute through good health to better food or nutrient consumption by the populations that need it most. So I think we always have to look at things from a balance of probabilities. And I think here we have to err onto the side of the greater good.
Absolutely, Russell. I mean, you also mentioned the integration of services as a means for jobs, right? Let's talk about that. How do we use the integration of services for jobs? And can it be utilized as another effective means to ensure that everyone can at least put a decent, healthy plate of food on the table and that at least everyone can have food, even if you don't have a job, especially in impoverished rural areas as well as informal settlements? That's where you specialize, Russell.
No, absolutely. And I think in rural areas, talent is everywhere, but opportunity isn't, right? And you have the largest unemployment amongst young people in particular on the expanded definition, if we track the ages between 15 and 35 in the rural areas. And there are no opportunities there. But when we think about it as a social stimulus, we have hospitals, we have schools, we have all kinds of social investments that we can make that can actually generate local employment. In the health sector alone, one of the things that we need to find or do better is to link people with care, particularly in tuberculosis. Sometimes that will require the rollout of mass community health campaigns, creating opportunities for rural women and boys to be able to be trained as community health extension workers, which will reduce our overall costs. If we find people with TB, link them to care and keep them in care using our social infrastructure, particularly the youth and women in those communities. It also opens up opportunities in digital transformation, where young rural matriculants can work where they are, contribute to strengthening health databases, investments in interpretation of AI and the use of AI. I think there's so many opportunities ahead of us. But to do it, that we have to be intentional. And I think there's a combination where we can improve public services through the use of technology, while at the same time creating opportunities through investments in infrastructure and the like for rural communities where they are. And like they say, rising tides lift all boats. When you find a way of employing more people in some of those rural districts, average incomes rise. And as average incomes rise, all of us are better. We create jobs on other aspects of the system, and we can have overall well-being. But then again, the stuff has to be intentional. And unfortunately, we're in that space now. We have to get ready for big transitions, digital transitions, age transitions. With the successes that we've had around things like HIV and AIDS, people are living longer, right? And as people live longer, they need different kinds of support. And that care economy can also be an opportunity to generate opportunities and jobs in areas where there aren't.
Right.
And I think that's the kind of creativity that we need to bring into our system, using the data, using taxes, and using our general demographic dividend to improve social outcomes for South Africans as we guarantee in our constitution.
Absolutely, Russell. More, effective collaboration starting at community level is what I'm getting, is where we need to be basically focused. Thank you so much. That was quite an engaging discussion. We're unfortunately out of time. That is Mr. Russell Rensburg, the Rural Health Advocacy Project Executive Director on Food Insecurity here in South Africa.